PAHO WHO and the government of Barbados has a long-standing relationship, almost 5 decades. We have collaborated in numerous technical cooperation activities, some of which have contributed to the achievement of sustained public health milestones. The impact of this collaboration has resulted in improvements that include the expanded immunization coverage, which has resulted in the eradication of several diseases from the Caribbean and the Americas, the control of infectious diseases, the training and retraining of human resources in health, the revision and updating of public health policies and plans that will improve the public health services that are offered to the people of the Caribbean. Our work has been aimed at enabling Barbadians to attain optimal health care, healthy lifespan, and prolonged life. Our relationship was further bonded when one of your sons, Sir George Arlene, led our organization as director from 1995 to 2003. We face new health challenges with new viruses such as Zika and chikungunya, but we also face chronic diseases such as diabetes, hypertension, and heart disease. These are the diseases causing most deaths of Barbadians and are costly to manage, but, on the other hand, are easily prevented through healthy eating, physical activity, moderation in alcohol consumption, and avoiding tobacco use. We all have a role to play in ensuring that we live in a healthier environment, be it one free of mosquitoes, one free of tobacco smoke, or one where physical activity and healthy diets are the easy and affordable choices. I want to take this opportunity to reaffirm the commitment of the Pan American Health Organization to work with the government and people of Barbados.
As Dr. Etienne mentioned, PAHO WHO's Barbados office is excited to share with you this 50th anniversary exhibition, which was conceptualized and produced in 2016 to commemorate significant milestones of our organization. 2016 marked 50 years of Barbados independence and its accession to the United Nations, while in 2017 we celebrate its 50th year of joining PAHO as a member state. We thought it fitting to stage the exhibition as it showcases a wealth of information on PAHO's work for the past 50 years, both organization-wide and more close to home here in Barbados. While it highlights PAHO's journey from the 70s to the 2010s, Barbados became a member state of WHO in April 1967, and a PAHO member on the 2nd of October 1967. Therefore, we are celebrating successfully 50 years. The exhibition's timeline starts in the 70s, and some of the main highlights for the decade you will be following with me soon as we go through the exhibition. The exhibition's timeline starts in the 70s, and some of the main highlights for this decade include the facilitation of education and training for countries, the establishment of PAHO's immunization program, the establishment of PAHO's emergency preparedness and disaster relief departments, and the management of vectors. These areas were extended in the 80s when the PAHO Fellowship Program was decentralized to the Barbados office. Smallpox was declared eradicated, and the battle to fight HIV/AIDS was launched. The disaster unit responded to Hurricanes Gilbert in Jamaica and Hugo in Montserrat. Those were the first 20 years of PAHO in Barbados. Follow me as we continue the journey through the rest of the time. The 90s saw the Caribbean Media Awards for Excellence in Health Journalism, and Sir George Arlene was the first Caribbean national elected as director of PAHO. In 2002, PAHO celebrated its 100th anniversary. In the Caribbean, several activities took place to commemorate the occasion, and many Caribbean nationals were recognized as public health heroes and legends by PAHO. As we entered the new millennium, in keeping with the established immunization program and in response to the requests from member countries, Vaccination Week in the Americas was launched in 2003. PAHO Strategic Fund was also established to provide the Americas with access to quality medicines and health supplies. Disasters continued to impact the Caribbean, and PAHO responded to hurricanes Ivan in Grenada, floods in Guyana, and the fire at St. Jude Hospital in St. Lucia. In 2006, the PAHO WHO Office for Barbados and the Eastern Caribbean countries was born. And in this last decade, on the 10th anniversary of Vaccination Week in the Americas, World Immunization Week was launched to underscore the importance of immunization in saving lives and to encourage families to vaccinate their children against deadly diseases. Rubella and congenital rubella syndrome were declared eliminated. PAHO continued to prepare and respond to emerging infections like Ebola, chikungunya, and Zika. And in 2013, Dr. Carissa Etienne became the first Caribbean woman to head PAHO. Natural disasters still continued to wreak havoc in the Caribbean, with a hurricane in Haiti and floods in St. Lucia, St. Vincent and the Grenadines, and the latest tropical storm Erika in Dominica. A climate change adaptation project was launched in Barbados to help strengthen national adaptive capacities to address health issues related to climate change attributable to water. Thank you for accompanying us on this journey. For details on how to acquire a collection of booklets on the exhibition, please contact us at brbcommunication@paho.org. Thank you.
PAHO.
PAHO, WHO.
WHO and Barbados.
And Barbados, together we grow.
Together we grow.
PAHO, WHO and Barbados, together we grow.
Yeah.